Hello and welcome to our annual members meeting, which we're holding for a second year in a virtual format. I'm Mike Deegan, Group Chief Executive at MFT. I'm pleased to have this opportunity to update you on our activities and performance during 2021. I'd like to begin by reflecting briefly on a year like no other we have ever experienced. COVID-19 has changed all our lives and created huge challenges for staff and services across the NHS. I'm immensely proud of the way everyone at MFT has responded, going above and beyond to maintain the highest standards of care in extremely demanding circumstances. Patients and their families have remained the key priority throughout this exceptional situation. We have maintained all our core services whilst also treating the large number of local people who have had COVID-19. And we will continue to build on the innovation and transformation opportunities arising from the pandemic. I'll tell you more about this later. To give you some background on MFT and our services, we are the largest acute trust in the UK. We employ over 28,000 staff and have a turnover of more than £2 billion. We provide hospital care to around 750,000 people in Manchester and Trafford. And we're also the single biggest provider of specialised services in England. We're now responsible for running a family of 10 hospitals across 6 separate sites, after North Manchester General formally joined MFT on the 1st of April this year. MFT also provides adult and children's community services for Manchester and Trafford through our local care organisations. Thanks to our dedicated clinical, academic and support staff, the 2.4 million patients we see each year have access to outstanding care and treatment whenever and wherever they need it. Usually it's my privilege to outline the wide range of activity across our trust over the past 12 months and to explain how our teams have delivered against our strategic priorities. However, as the global pandemic has affected every aspect of our performance, I'd like to concentrate on how MFT has responded and to focus on our 3 key priorities: maintaining safe access to care and treatment for all our patients, caring for our staff, delivering life-saving COVID-19 research studies and clinical trials. The massive and rapid transformation of wards, theatres, A&E departments and other facilities enabled us to safely treat COVID-19 patients without compromising other services. Our infection prevention and control teams made a vital contribution to keeping both patients and staff safe. They trained colleagues in the correct use of PPE, risk assessed all our sites and set up COVID-19 testing units in hospitals in the community. To give you an idea of the scale of the procurement team's efforts, our PPE distribution centre is delivering over 8.5 million PPE items each month to 548 locations within our trust. Throughout the pandemic, the procurement team have made sure that all our staff have access to the right PPE. Inevitably, however, the need to prioritise COVID-19 patients and stand down planned activity has led to many patients waiting longer than we would want. MFT is not alone with this, as the rest of the NHS is facing the same challenge. The condition of patients, limitations on bed capacity and social distancing requirements all had an impact on how quickly we can treat patients who are on waiting lists. So, for example, we saw a significant rise in the number of patients waiting longer than 52 weeks for treatment. Safety has remained a priority. All patients with long waits are clinically assessed and prioritised for treatment. As we continue to restore our services, this means that those with the most immediate need will be seen first. At the start of April 2020, we moved into the escalation phase of the pandemic, continuing work that had begun in February and March. 5 principles underpinned every aspect of the MFT response. It must be safe, effective, caring, responsible to people's needs, and well led. Alongside our own MFT response, we also led a programme to establish the NHS Nightingale Hospital North West, a major additional resource for the region. Amazingly, it took just 2 weeks to turn a conference centre into a fully functioning health facility, which cared for more than 450 patients. We also took a lead role in coordinating the wider Greater Manchester Hospital's response. The Greater Manchester Provider Federation Board brought together local NHS trusts to provide mutual aid and agree common approaches. This ensured the patients had access to a similar level of care wherever they were treated, and no hospital was overwhelmed. Several of our senior colleagues also supported the national efforts to combat the pandemic. By providing modelling analysis and clinical guidance to the government's Scientific Advice Group for Emergencies, SAGE, they helped to shape the policies and decisions supporting critical care and other services across the country. Alongside reconfiguring our services, a key priority was to make sure our staff stayed healthy and well. We significantly extended our existing staff wellbeing programmes, and a high level of support remains in place for all colleagues. Our employee health and wellbeing service provided 24/7 support to staff with their mental, physical and emotional health. Our annual staff flu vaccination campaign was delivered at pace across MFT to protect all colleagues. Generous donations of food, beverages, meals and other items by businesses, charities and local residents were shared amongst our staff. The first COVID-19 staff vaccination clinics opened in December 2020. In just 3 months, over 74,000 staff, colleagues from partner organisations and patients were vaccinated. We've since exceeded 150,000 jabs, and the clinics are now offering vaccinations to teenagers and young people. We also listen to the experiences of our staff and use this knowledge to shape different, more flexible ways of working, and to develop and launch our MFT People Plan, which is designed to help create a working environment we can all be proud of, one that is inclusive and which values diversity. As one of the UK's leading research trusts, MFT has been a key player in the global effort to develop potential treatments for COVID-19. Along with patients admitted to our hospitals, MFT staff and their children and healthy local residents have taken part in COVID-19 studies. MFT researchers discovered that an existing drug, dexamethasone, significantly lowered death rates in COVID-19 patients with respiratory complications. This was the first treatment breakthrough and is now part of standard care. In November 2020, MFT recruited the world's first participant to a phase 3 COVID-19 vaccine trial, and by the end of March 2021, there were 40 COVID-19 studies at MFT, with nearly 10,000 participants. Although significant time, energy and resources have been focused on COVID-19, I'm pleased to tell you that our pre-pandemic transformation programmes continued to make good progress last year. Our teams worked very hard to deliver the final element of the Single Hospital Service programme, which began in 2016. The programme aims to deliver a wide range of benefits for our patients by bringing together clinical and non-clinical services into extended teams working across our hospitals. Under the programme, MFT took responsible for North Manchester General Hospital on the 1st of April last year. This was done through a management agreement with the Board of Pennine Acute Hospitals NHS Trust, its parent organisation. Positive working relationships forged between North Manchester and MFT teams supported the delivery of effective care at North Manchester throughout the pandemic. They also ensured a seamless transition as North Manchester General Hospital formally became part of MFT on the 1st of April 2021. Our clinical service strategy has continued to support improvements in innovation in diagnosis and treatment for our patients, both in normal times and as part of our pandemic response. To give you just a few examples, single MFT-wide waiting lists have been introduced. This means that patients are treated in order of clinical priority, whichever hospital within MFT they are attending. Manchester Royal Eye Hospital is testing a new model for glaucoma, where patients are followed up in their community rather than having to come to hospital. The dedicated hip fracture unit at Wythenshawe Hospital and Vascular Arterial Centre at MRI each bring together all the specialist skills needed in a single MFT service. Virtual outpatient consultations by phone or the internet are enabling patients to continue to get high quality care without leaving their home. Where these changes were made as part of the pandemic response, we are working with commissioners to put the changes on a permanent basis. I'd like to close with some personal reflections on what I've found inspiring during 2020-21. The sheer professionalism and dedication of our staff in looking after our patients and caring for each other. When the pandemic was at its peak, colleagues found the extra resilience to keep going, and it truly made a difference. The tremendous level of support for the NHS, whether people made scrubs, provided hot meals, or clapped on their doorsteps, it was a huge boost to morale and also very humbling. The outstanding degree of collaboration and innovation within MFT and across the wider NHS. This helped us to implement within days changes which might ordinarily have taken months or even years to introduce. There are still many challenges ahead, including maintaining urgent and emergency care, reducing waiting lists, and meeting increasing demand. I want to assure you that our teams are working extremely hard to restore and enhance our services across all these areas. We're still very far from being back to normal, but hope to make positive progress over the coming months. Finally, a heartfelt thank you to everyone who has contributed to delivering safe, compassionate care for our patients and their families in these unprecedented times. We are very grateful to our hard-working staff, partner organisations, volunteers, supporters and fundraisers. We simply couldn't have done it without you.